My name is Dr. Carmelita Coca, and I'm a pharmacy practice resident here at Kingman Regional Medical Center. And today we will be discussing managing pain like a boss, over-the-counter pain relievers. So by the end of this presentation, I hope you're able to review the definition of pain, understand what is considered muscle and skeletal pain, and recognize key points for over-the-counter pain medications, including acetaminophen and non-steroidal anti-inflammatory drugs, also known as NSAIDs. This will include those that are taken by mouth and topically. So to begin, what is pain? Pain is an unpleasant sensory and emotional experience associated with, or resembling that associated with, actual or potential tissue damage. Now, there are two main categories that we will talk about today. And so the first is acute pain. This is defined as pain lasting less than 4 weeks, and chronic pain, anything lasting at least 3 months. For our presentation today, though, we will focus on acute pain. So to begin, we will talk about how to measure the level of pain according to a pain measurement scale. This one here is considered the Wong-Baker-Faces scale. Now, you may have seen this when you've gone to your provider's office or your doctor's office, and we have a scale here from 0 to 10. Indicating 0 with no pain at all, 10 the worst pain imaginable. But it also has smiley faces to make it a little easier for you as the patient to describe your pain to your provider. This is going to range from a happy face of no pain to a sad and upset face of the worst pain imaginable. This is a way to help us figure out what your pain level is at, since it is hard to describe that at times to your provider. So now, what is muscle and skeletal pain? Muscle and skeletal pain is pain that affects the bones, the joints, ligaments, muscles, and tendons. So you may have experienced this before, where you may have pain in your knee or in your shoulder, or this may be something that you experience within your lifetime. Now, there are non-medicine options. So before you start looking at those over-the-counter pain relievers, you can try these other options first to see if they help with the pain. So for any kind of muscle cramps you may be experiencing, you can do stretching and massaging of the affected area, followed by immediate rest. And then for non-inflammatory pain, so that's pain without swelling or redness, so there is heat therapy, things like a heating pad or a warm cloth. And for that, you can use it for 15 to 20 minutes for up to 3 to 4 times per day. Then we also have the RICE therapy. RICE stands for rest, ice, compress, and elevate. So rest is to rest the injured area for 48 hours. Ice is to ice for 20 minutes at a time, 4 to 8 times per day. Compress, if you have any swelling, you compress the area with a bandage. And then elevate. You want to elevate the limb, so like your ankle, about 6 to 10 inches above your heart with something such as a pillow. So now we will discuss some topical pain medication options. These are things such as lotion, gels, ointment that you apply directly to the skin to the area that feels the pain, so like your knee or your shoulder. These help with the localized area rather than taking a pill that will affect your entire body. Items of this includes Icy Hot, Bengay, capsaicin, even those pain patches you may use on your lower back. These all are included in that topical pain medication category. Now, we're not going to go into these details specifically of these products, but I do want to go over some safety tips in case you decide to use these. So for the area that you are applying this lotion or ointment, you do not want to bandage it tightly, and you do not want to use heat, again like a heating pad, over the area that you put this medicine on. The reason for this is we do not want it to get into your skin faster than it should. So avoid bandaging it and avoid putting heat on that area. So for reasons not to use these products are going to be if your skin is wounded, damaged, broken, or irritated. This is for the same reason as before. We don't want that medicine to get into your system quicker than it should. And then if you are using these products and you are experiencing pain, swelling, or blistering of the skin from this product, you do not want to use these either, because we do not want to make it worse than it was before. So again, more reasons not to use these products. Now, we only want this lotion, and ointment to be on top of your skin. So do not touch your eyes, inside your nose, your mouth, or genitals after using these products. So you want to wash your hands after you apply this. And then for our little ones, anyone under the age of 2 years old, do talk to their doctor before so we can make sure it's safe for them to use. Now for over-the-counter by mouth pain medications. These are things such as a pill or a capsule or a tablet that you'll put into your mouth and swallow with a glass of water. This category includes acetaminophen, along with the group that has ibuprofen, naproxen, and aspirin, which are also considered NSAIDs. We will begin with talking about acetaminophen, also known as Tylenol. So here I want to introduce two terms that you may or may not be familiar with, and that is going to be considered the generic name of a medicine and the brand name of a medicine. Here the generic name is acetaminophen. That is the actual medicine that is in the product that you are taking when you don't feel good. Tylenol is the brand name. That is the name of the company that makes this product, and they call it Tylenol. So for you to know, understand that acetaminophen is in the products or maybe in the products that have the label of Tylenol, and that Tylenol can also be considered acetaminophen. Acetaminophen is used for pain and fever. Today we are talking about its use for pain, and its effectiveness with the pain can last for about 4 to 6 hours when you take it. Now there is a maximum amount of acetaminophen that you should take for adults. And so those doses can range from 325 milligrams to 1,000 milligrams every 4 to 6 hours, but no more than 3,000 milligrams per day. As far as children's doses, do talk to your provider about those just to make sure, again, we're keeping our little ones safe. The reason for avoiding doses over 3,000 milligrams per day of acetaminophen is that it can lead to severe liver damage if you're taking higher than 3,000 milligrams per day. Now, if you're taking 3,000 milligrams per day for multiple days in a row, this severe liver damage may occur just after 1 week. So you do want to be aware of how much acetaminophen you are taking. Now, taking multiple products with acetaminophen could put you at risk of that overdose of taking too much. So here we have multiple products. One does say Tylenol in it, and we already discussed Tylenol may contain acetaminophen. But we have multiple products here that you may take when you have a cold that it does not make it obvious acetaminophen is in these products. So we have sleep medicine, cough medicine, sinus medicine, menstrual cramp medicine, even some Dayquil and Alka-Seltzer. And so it may not be obvious on the box that these contain acetaminophen, but they do. So this can contribute to the higher amount of acetaminophen throughout the day without you even realizing it when you have a cold. So this brings along the importance of reading a drug information label. These are on the back of all of our over-the-counter medications, and this will tell you what medicine is in each product, as we can see here on the right. If you look in the back of the product, you will see drug facts. Underneath, you will see active ingredient, and they're highlighted in yellow. You will see what the active medicine is in there. Here's where you want to look to see if acetaminophen is in that product. Again, even if it doesn't say Tylenol on the box, acetaminophen may be in there. So understanding where to find this information is very important so you know what you are taking. Now, another section on this drug label is dosing instructions. So this will tell you how much you should take within a day and how often. So this will help you maintain that lower amount of acetaminophen throughout the day. But remember, this is only for that one product. So if you are taking multiple products with acetaminophen, you may be taking more, even if you're following the directions on the back of the box. So knowing how to read the active ingredient section and the direction section is very important when you're taking these products over the counter. Now, if you do happen to take too much acetaminophen, these are some signs that you may experience. You may have nausea, vomiting, drowsiness, confusion, and even abdominal pain. Now, these signs are very generalized, so because you may be experiencing these does not mean that you are having an overdose. But if you know that you're taking high amounts of acetaminophen for multiple days and experiencing these symptoms, this may be a consideration to think about. A line that you can call is the Poison Control Center, which the number is provided there on the screen. And you can call and ask for more information to see if you are experiencing an overdose. However, if you do feel like this is a medical emergency, you're in a lot of pain, and these symptoms are severe, do get medical attention right away. Call 911, get to the emergency room. Again, we want to avoid that liver damage if that is what is occurring. Now we will discuss NSAIDs. NSAIDs, again, are non-steroidal anti-inflammatory drugs. This category includes ibuprofen, naproxen, and aspirin. So again, to emphasize the difference between that generic name and brand name. Generic name, the actual medicine in the product is ibuprofen, but the companies that make it call it Advil and Motrin. So keep that in mind if you see either one of these, they both may contain ibuprofen. Same thing with naproxen. Naproxen is the actual medicine in your product. Aleve is the name that the company gave it. So if you see Aleve, it may contain naproxen. And then aspirin. Aspirin is the actual medicine in your product. Bayer is the name of the company gave the product. So if you see Bayer, it may contain aspirin. So again, just remembering that generic name compared to the brand name and looking at those ingredients. Now, NSAIDs are used for pain, fever, and also swelling and inflammation. So if you have that puffiness, that inflammation, that redness in an area, this is what NSAIDs will help with, where Tylenol or acetaminophen will not. So the difference is there between the two products. Now, ibuprofen and aspirin last about just as long as acetaminophen, 4 to 6 hours. But then naproxen lasts a little bit longer, so 8 to 12 hours. So you may not need to take this as often. Now, discussing those maximum amounts for adults for these different medications are here on the screen. So ibuprofen, you can take doses from 200 to 400 milligrams every 4 to 6 hours with the maximum of 1,200 milligrams per day. For aspirin, doses ranging from 650 to 1,000 milligrams every 4 to 6 hours with a maximum of 4,000 milligrams per day. And naproxen, 220 milligrams every 8 to 12 hours with a maximum of 600 milligrams per day. Now, if you are 65 years or older, you do want to have less than that recommended amount for adults in general, so your dose would decrease to 440 milligrams per day. So just keep that in mind for when you're taking these medications for mild to moderate pain. Same point here I want to make with the NSAIDs is that they are contained in other products that may not have that brand name on there. So these products here do not make it obvious ibuprofen, aspirin, or naproxen are in these, but do keep in mind looking at the drug information label and looking at the active ingredients to see if any of those are contained in these products. Now, with NSAIDs, there is that risk of stomach bleeding if you fall into any of these following categories. If you're older than 60 years old, if you have a history of stomach ulcers or bleeding problems, if you are taking a blood thinner or steroid medication, if you are taking other medications that have NSAIDs with them, which we just discussed on the previous slide, if you're having 3 or more alcoholic drinks daily while taking this medication, and then overall taking more than directed. So keeping all of that in mind that yes, if you fall into any of these high-risk categories, you may be at risk of stomach bleeding from taking ibuprofen, naproxen, or aspirin. But it's also okay just to take it for a headache once in a while. Just look for the signs and symptoms of this. Now, a point I do want to make with aspirin and children is that if a child is experiencing the flu, recovering from the flu, or currently has a chickenpox or recovering from the chickenpox, we want to avoid aspirin in those 15 years and younger. This is due to a condition called Reye's syndrome. It's a rare but serious condition that causes confusion, swelling in the brain, and liver damage. So if you notice that you're considering giving aspirin to a child, again, 15 years and younger, and they may be having the flu, recovering, or the chickenpox or recovering, then you may want to look at an alternative option such as acetaminophen or ibuprofen in this category just to avoid this situation. Now, when should you see your doctor for this muscle and skeletal pain? If you're experiencing that severe pain, so again, we were focusing on that mild to moderate, so this would be a pain score of 6 or higher, a pain that lasts longer than 10 days, pain that continues for more than 7 days while using that topical treatment that we talked about earlier, the lotion or gel. If the pain gets worse or the pain type changes, if you're experiencing any kind of abdominal pain, for our little ones less than 2 years old, if the pain you're experiencing is also accompanied with nausea, vomiting, or fever, if you have any kind of back pain, but also the loss of bowel or bladder control, so issues in the bathroom, and if you may have a fracture. These are all times where you may want to consider talking to your doctor, then self-treating with over-the-counter pain relievers. Now, that was a lot of information that we covered today, so I do want to highlight the main takeaway points from this presentation. So one, again, there are non-medicine options that can help you with this muscle and skeletal pain that you can consider before looking at the over-the-counter pain relievers. 2, acetaminophen and NSAIDs are in many products that you may not be aware of, especially when you're sick. So keep that in mind, because if you take too much acetaminophen, it can cause liver damage. And if you take too much ibuprofen, naproxen, or aspirin, it may cause stomach bleeding if you fall into those high-risk categories. Which 3 is why it's so important to understand how to read that drug information label and where to find the information that will keep you safe. And then lastly, there are many reasons why you should see your doctor rather than self-treating with these pain relievers for that muscle and skeletal pain that may be present or is just not going away. So I want to thank you for your time again for listening to this presentation. And again, my name is Dr. Carmelita Coca, and I'm a pharmacy practice resident at Kingman Regional Medical Center. Thank you.